Backing up, I broke up with the oncologist that I started with at the beginning of my cancer journey. A fantastic cancer center, fantastic, treatment. Everything was great. In fact, my oncologist was also, I'll say, very nice. The problem was, for me, I didn't feel that at key critical moments in my treatment that I was being really supported, or that the wins, those little wins along the way, were even acknowledged. So let me give you an example. I went through chemotherapy, but before my treatment cycles were finished, at various intervals along the way, I had to go in for scans, imaging scans, PET CT scans, where they basically are taking a picture of, your body, and they want to see if the cancer is shrinking or responding to the chemotherapy. In my particular case, after the first follow-up scan, my scans were clear. And for a stage 4 patient, a stage 4 diagnosis, meaning it has spread, it's metastatic, that's a big deal. It's a big deal because I had only gone through 2 rounds of chemotherapy, 2 out of 6. Okay. So no matter whether you are, going through breast cancer diagnosis or whatever it is that you're going through, or if you're listening and you're a supporter of someone who is, going through a journey, when something like that happens, okay, and you get what I'll call a progress report from your doctor, I think it's pretty normal and human nature to want to ask the doctor, hey, is this normal? Is this good? Is this above average? Is it below average? What do you see, doc, with your other patients that you're treating who have undergone XYZ treatment and then have a follow-up and it's either shrunk or it's shrunk a lot or it's gone? That is a point in time at which I think it's critical and very reasonable for someone to ask their oncologist, is this good? Is that good? You don't have to compare me to other people. Just in general, is it positive? And I say this because I think it's Captain Obvious. It is. It is super positive when you're going through chemo and you get a follow-up scan to see how much it has shrunk, and it's gone. And the radiology report says there's complete metabolic response to the treatment. I kid you not. My oncologist did not bat an eye. She did not blink. She did not smile. I basically got no acknowledgement from her at all whatsoever that it was good.